Assalamu alaikum dear students. Today we will discuss Hematology MCQs part 3rd. The hemoglobin synthesis starts at the stage of dash. Option A, proerythroblast. B, basophilic erythroblast. C, polychromatophilic erythroblast. And option D, reticulocyte stage. So the correct option is A, proerythroblast. Explanation is hemoglobin synthesis begins in proerythroblasts. Which one of the following does not cause pancytopenia? Option A, iron deficiency. B, folate deficiency. C, aplastic anemia. And option D, acute myeloid leukemia. So the correct option is A, iron deficiency anemia. Explanation is iron deficiency anemia causes anemia only, not pancytopenia. Subscribe now and press the bell icon, never miss an update from a technologist. Which one of these statements is true about hemoglobin? Option A, one molecule contains one atom of iron. B, it is broken down in macrophages. C, it is different in children and adults. And option D, it has a low level in blood at birth compared with adult life. So the correct option is it is breakdown in macrophages. Explanation is macrophages degrade hemoglobin into heme and globin. So this is very important MCQ. Which one of these statements is true about reticulocytes? Option A, they contain DNA, not RNA. Option B, they are raised in megaloblastic anemia. C, they are raised 12 months after splenectomy. And option D, they are raised after hemorrhage. So the correct option is D, they raised after hemorrhage. Hemorrhage triggers increased reticulocytes release. Dash are mainly involved in hemostasis. Option A, RBCs. B, WBCs. C, platelets. And option D, none of the above. So the correct option is C, platelets. Platelets are key in hemostasis, clot formation. The largest leukocyte in the blood circulation is dash. Option A, neutrophil. B, lymphocyte. C, monocyte. And option D, eosinophil. So the correct option is C, monocyte. The monocyte's normal range is 12 to 20 micrometer, are larger than neutrophil, lymphocytes and eosinophil. Eosinophil normal count range is dash. Option A, 1 to 6%. B, 4 to 10%. C, 20 to 40%. And option D, 40 to 70%. So the normal range of eosinophil is 1 to 6%. So the correct option is A. The eosinophils count constitute 1 to 6% of the WBCs. So this is very important MCQs. In TLC, total leukocyte count cells are counted in dash part of the chamber. Option A, in one corner big square. B, in central small square. C, in 4 corner big squares, and option D, all of the above. So the correct option is C, in 4 corners big squares. For WBC counts, cells are counted in 4 corner squares in the new bar counting chamber. So this is very important MCQs. EDTA is an anticoagulant that removes dash from blood. Option A, magnesium, B, calcium, C, carbonate, and option D, protein. So the correct option is B, calcium. So EDTA chelates calcium, preventing coagulation. Dear students, this is very important MCQs. During the first month of prenatal life, hematopoiesis is found in dash. Option A, bone marrow, B, liver and yolk sac, C, kidney, and option D, lungs. So the correct option is B, liver and yolk sac. Explanation is early hematopoiesis occurs in yolk sac, weeks 2 to 8, then shifts to the liver. The diameter of a normal RBC is dash. So the correct option is A, 7.5 micron. The normal RBC diameter is 7 to 8 micron. So this is very important MCQs. Which one of these is a primary lymphoid organ? Option A, adrenal gland, B, thymus, C, skin, and option D, lymph node. So the correct option is B, thymus. Primary lymphoid organ are thymus, which mature of T cell, and bone marrow, B cell maturation. Subscribe now and press the bell icon, never miss an update from a technologist. The hematopoietic compartment of bone marrow produces approximately dash blood cells per day. Option A, 5000 billion, B, 500 billion, C, 50 billion, and option D, 5 billion. So the correct option is B, 500 billion. The bone marrow produces 500 billion cells daily. So this is very important MCQs. Which one of the following is not a significant component of bone marrow stroma? Option A, endothelial cells, B, adipocytes, C, fibroblast, and option D, epithelial cells. So the correct option is D, epithelial cells. Bone marrow stroma consists of endothelial cells, adipocytes, and fibroblasts, but not epithelial cells. So this is very important MCQs. Extravascular hemolysis occurs in option A, spleen and kidneys, B, spleen, liver and kidneys, C, liver, spleen and bone marrow, and option D, spleen, kidney and bone marrow. So the correct option is C, liver, spleen and bone marrow. Macrophages in these organs have phagocytosed old RBCs. Throughout fetal life, the liver is the chief organ for hematopoiesis. Option A, liver, B, spleen, C, kidney, and option D, bone marrow. So the correct option is A, liver. The liver is the primary hematopoietic organ from weeks 6 to 24, 6 to 24 weeks of gestation. 65% of the hemoglobin is synthesized in the erythroblasts and 35% at the reticulocyte stage. Option A, true, B, false, and option C, all are false. So the correct option is A, true. Explanation is most hemoglobin synthesis occurs in erythroblasts 65% with the rest of the reticulocytes. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। फिब्रिनोलाइसिस इज़ डन बाय विच ऑफ द फॉलोइंग? ऑप्शन ए प्लाज्मिनोजन, बी प्लाज्मीन, सी फिब्रिनोजन एंड ऑप्शन डी थ्रोम्बिन। सो द करेक्ट ऑप्शन इज बी प्लाज्मीन. Plasmine degrades fibrin clot. So this is very important MCQs. To make a good smear, place the spreader in front of the glass slide at an angle of dash. Option A 30 to 35, B 40 to 45, C 45 to 50 and option D more than 50. So the correct option is A 30 to 35. The optimal range for blood smear is 30 to 35. Thank you for watching my videos.